Talking a lot about the coronavirus. A lot of you at home are certainly worried, and this morning we're going to try and address some of the concerns you may have and try and sort out some of the myths from the facts associated with the outbreak.
We have a very special guest this morning. Dr. Evelyn Montalvo-Stanton is the chair of pediatrics at UNLV and a pulmonary specialist. Thank you so much for being here, doctor.
Thank you for having me.
We're happy to have you, and we have been getting a lot of questions on our Facebook page from you, our viewers. We'll get to those here in just a moment. We wanted to start, though, with asking, you know, we've been talking about this every day. You see a lot of coverage all over the media. How worried should people be, doctor, and are you worried about seeing cases here in Las Vegas?
Well, so far we haven't had any cases in Las Vegas, so we've been fortunate. But we don't know what the trend is going to be going forward, so we have to continue being cautious as to what we're doing and how we take care of ourselves. So I think that people are nervous, and I think that they have every right to be so. But I think education and preparation is what's key here.
Well, let's get to some of the viewer questions, and I'm going to add a little bit to it as well. This is from Ophelia, who asked, what are the first signs of the virus? And I think pure and simple, maybe people would just want to know, what is coronavirus? What are everyone talking about so much?
So coronavirus is obviously a virus. It's similar to the flu. I mean, we have had horrible flu season this year.
Yeah.
The symptoms have been pretty much the same. But usually what's different about corona is that it really causes respiratory symptoms with high fevers. And usually the incubation period is about 2 to 14 days. And so you can start with a cough, and the cough can get progressively worse with shortness of breath. And that's one of the key things that we see with this particular virus.
Okay.
Joanne wants to know which groups are the most at risk to contract the coronavirus.
So we've been seeing it in adults and in the geriatric population. There were very few cases of children in China, so we haven't seen any children being affected here in the United States. And so the other vulnerable patients are usually patients that are immunocompromised or patients who have pulmonary cardiovascular disease.
Another question that we got from you, our viewers at home on Facebook, Sean wanting to know, with the incubation time you just referenced, is it likely someone's already been exposed in southern Nevada? We know there are no cases here in Nevada, period, but this is a question from Sean. Is it possible someone has it here and just maybe doesn't know it?
That's a good question. I mean, I think that the key thing is always asking about travel, because most of these symptoms have been related to travel, although the one case that we had recently there was no significant contact. But if you have symptoms and you're worried about it and you have a fever and cold with a cough, the best thing to do is to stay home and contact your doctor.
Yeah.
And the last thing, Marcel asked, a lot of people, of course, in the tourism industry here, meeting people from all over the world, how do people in the customer service industry protect themselves, too?
Well, again, this goes with trying to have good hygiene. That is, you know, hand washing, using hand sanitizers. If you're coughing, cough into your elbow, not spread those respiratory droplets in the air, and again, if you're sick, just stay home.
Yeah.
All right.
All good ideas and all things to keep an eye out here. Dr. Montalvo-Stanton, thank you very much for joining us this morning from
Thank you for
UNLV's
having me.
School of Medicine.